So we are dealing with, what we are dealing with was hematology. What you are dealing with first leukemia. Different types of leukemia, that part is over. Acute leukemia, chronic leukemia, and then what you have been taught? Lymphoma, a part of lymphoma. Lymphoma comes under hematolymphoid system. This is a separate category of hematological neoplasm. That means hematological malignancy. It's a separate category. Leukemia, lymphoma, they arise from B cell or T cell. This entity, which I have written over the blackboard, arises from B lymphocyte only. B lymphocyte, which is capable of producing immunoglobulin. That you know from your first year studies, hematology, immunoglobulin. So, from B lymphocyte, ultimate, what is the end result? Plasma cell. I have drawn one normal plasma cell. You know the basic morphology of normal plasma cell. It's a cell with eccentric nuclei, cartwheel appearance of the nucleus, and a half. Half is nothing but a clear space around the nucleus. Everything in our body, all cellular mechanism in our body is controlled by certain growth signals. Cells divide, cells proliferate, cells die. These are controlled by different mechanisms, which you have read in general pathology, in cell growth. There are different cell cycles, which is controlled by growth factors, apoptosis. What else? Growth factor, apoptosis, different DNA repair mechanism, etc., etc. So there are different pathways. Normal pathway, cell will die. In abnormal pathway, under the influence of cytokines. Cytokines mean interleukins, interference, mainly. If they are uncontrolled, the normal plasma cell will grow into myeloma cell. In that condition, we call it plasma cell myeloma. As it is, the previously, when we were a student, say years back, 20 years, 25 years back, we call it multiple myeloma. That means myeloma which affect different parts of the body. The disease remaining same. We means World Health Organization has slightly modified the nomenclature. We call it plasma cell myeloma. So all your questions in competitive exam, in university exam, will appear as plasma cell myeloma. Very big name, you know already, which is nothing but B lymphocyte transformed into plasma cell, transformed into malignant plasma cell. So, what plasma cell does? Ki kore plasma cell? Antibodies. We have two types of immunity, cell immunity, plasma cell. Cell immunity is controlled by T cell. Here it is controlled by B cell. But remember, these B cells are not, these plasma cells are not normal. These are abnormal. So, they will produce heavy amount of antibodies, which will fail to protect our body. Otherwise, body will be more prone to infection. So, if your blood has got heavy protein, abnormal protein, more than 3.5 gram %, you will have different types. Your blood will be thick like motor mobile, thick plasma that will be stuck in different parts of the body. That will give rise to different set of symptoms. So, this is the basics of plasma cell myeloma. Though it's a hematolymphoid disease, it is a systemic disease. It will affect all part of the body. Remember, there is a spectrum of diseases. The plasma cell diseases, there is a spectrum. The initial one, when the immunoglobulins just start to rise, we call it MGUS, myeloma of unknown significance. Then there is another transition which is called smoldering myeloma. It is not full-blown myeloma. Just before that, everything will be above, but symptomatology are less. Patient will suffer less. The full-blown disease is called plasma cell myeloma. So, it's a spectrum of disease. At one end, most benign, most less hurtful part is there, less harmful part is there. On the other hand, the most malignant part is there. You may get the patient at any point. So remember this. Don't think that plasma cell myeloma is always will present to you with full-blown malignant features of full-blown malignant features. So this is the background. I hope you will understand the background. If you understand the background, you will decipher your book, your chapter better. So this is the heading, nothing to say about this. Multiple myeloma, the first one, the first part, the initial, the left end of the spectrum is MGUS. MGUS, just remember the name, most benign part of this paraproteinemias. This is MGUS. Moving on. Risk factor, any malignancy are found because of different kinds of exposure. Suppose it may be environmental, it may be familial, it may be hereditary, etc. It may be due to chromosomal aberration. So same thing holds good for plasma cell myeloma also. A normal plasma cell, we generally in your undergraduate examination, we generally ask you how a normal plasma cell look like. We ask you in the Viva table. So this is round, cytoplasm is basophilic, the nucleus is round, eccentric, perinuclear halo, absent nucleoli, and cartwheel appearance of the chromatin. These these are there in every book. How it comes. This is for lymphoid stem cell, lymphoblast. This B lymphocyte, then plasma cell. Exactly, it looks like this. It's a very easy to identify plasma cells. Not a very difficult task. Structure of immunoglobulin. Just to recapitulate that there are heavy chain, there are light chains. Because this plasma cell myeloma, they have their light chains secreted in the urine also. So some few percentage of plasma cell myeloma, they may present with light chains in urine, not all. Heavy chains are in the in blood, they cannot be excreted. Light chains are generally excreted in some of the percentage. So this is the significance. Gammopathy means where there is excess production of antibodies. All these group of diseases are known as gammopathy also. All these group of diseases are known as paraproteinemia also. Both are same. Suppose you suffer from malaria, a chronic disease. You may have high level of immunoglobulin. Say malaria, Kala Azar, a patient from Bihar, Nepal, they suffer from, and a patient vis-a-vis a patient who suffers from plasma cell myeloma. So what will be the difference in immunoglobulin? একটা patient তার chronic malaria আছে and another patient who is suffering from plasma cell leukemia. Both are having high immunoglobulin level. What is the difference? One is polyclonal. Plasma cell myeloma is monoclonal. In that means if it has got one type of light chain, it will have only one type, not different types. If it is kappa, it is kappa. If it is lambda, it's lambda. This is called monoclonal. Without, write it on your brain. Without monoclonality, you cannot call any neoplasia malignant. Polyclonality cannot give a stamp of malignancy. Remember this. So you'll hear different nomenclature: paraproteinemia, gammopathy, etc., etc. This only means that there is increase in abnormal proteins secreted by neoplastic plasma cell. Nothing else. Symptomatology are variable and of different types. As the original name was multiple myeloma, the peak in protein electrophoresis, we call it M protein. As the original name was multiple myeloma. This is monoclonal gammopathy of underlying significance, where the plasma cells percentage are low, where the full-blown symptomatology are not there. It's an initial stage. You can read it from any standard textbook. It is there. So plasma cell percentage are very less. Symptomatology are very, very less. So you know what is given. Plasma cell percentage, that is myeloma cell percentage, are less than 10. Proteins are less than 3 gram %. These two factors we always consider for giving a diagnosis of plasma cell myeloma. So it's increased, but not beyond a certain limit. MGUS. Multiple myeloma. So as the old name is also there, as some books are also displaying the old name, I have kept this name, multiple myeloma. It's a neoplastic proliferation characterized by plasma cell accumulation in bone marrow, monoclonal protein in the serum or urine, and tissue damage. So basic things are the plasma cells in the bone marrow. They will spread in different parts of the body. They will affect those body. They will have a harmful effect over the body due to cytokines released from the plasma cells. These you all know, already told. Always remember that if you have got any elderly individual in your family, in your extended family, which is say about 50 years of age, and who is complaining that Amarna, I am having pain, it's called low back pain. So any elderly person in your family, in your extended family, if complains of low back pain, think of plasma cell myeloma. This malignant disease. Always be very careful. It generally do not affect younger individual, like leukemia, lymphoma. No, কখনো younger individual there হবে না. Always in the elderly or older people. Just few years back, one of professor in medicine, he suffered from plasma cell myeloma in Calcutta, and he died by now. Okay, suppose, let me consider one case scenario where a patient is suffering from very chronic disease, say chronic tuberculosis, or chronic kala-azar, or chronic anemia, undiagnosed. We have done a bone marrow. Bone marrow shows high plasma cell. How can you differentiate it from plasma cell myeloma? Suppose I have done a bone marrow examination of any patient who is suffering from, say, fever of unknown origin for 6 months, and another plasma cell, leukemia, plasma cell myeloma. How do you differentiate? Ki kore differentiate korbo? In that case, first is the percentage of plasma cell, maybe 6%, 7%, will never exceed 10%. Number 1 point. Second point, the plasma protein, total plasma protein, will never go beyond 3 gram %. And if you do a serum protein electrophoresis, you won't get a band, spike band, a steep band. You won't get. You will get a band like this, which means it is polyclonal. In this way, we differentiate. Next. So these are from our one reported book. It's there in every book. Nothing to be described. So we have described this M gas where everything is low. We have described smoldering multiple myeloma where the serum protein is high. The serum protein may be high, but there is no systemic symptoms. There is no evidence of systemic organ damage. It is called smoldering myeloma. Smoldering means which is very chronic, which is staggering, at a chronic phase. In smoldering, you will always have immunoglobulin more than 3, but organ damage, systemic damage will be less. And here is the main multiple myeloma or plasma cell myeloma. That is very, very important for you. You may forget this too. Just know the name. Forget this too. Concentrate on this. So, due to different action of the cytokines, the plasma cell leukemia may have this biochemical reaction. What is those biochemical reaction? Calcium level more than normal. There is renal insufficiency. There is bone lesions. due to increased osteolytic activity, either on X-ray or on MRI. There is anemia. So, these are the symptoms of systemic organ damage. Anemia, because bone marrow is normal, erythropoiesis is compensated. Kidney, because of the high protein, they cannot filter. There will be renal insufficiency, and due to high osteolytic activity, if you do X-ray or MRI of any bone, there will be osteolytic activity. So these are the criteria which prove that there is systemic organ damage. Acha, clinical finding details you will read. I have already discussed. You first read the pathogenesis. What happens actually? Then you can yourself, without reading, you can design what will be the symptomatology. You don't have to mug up. All this symptomatology you yourself can design if you know the pathogenesis just in nutshell. Okay? Next. So, anemia, infection. So, question is, why anemia? Why anemia? Because normal erythropoiesis is replaced by abnormal plasma cell. Why infection? Why repeated infection? Because those immunoglobulins are not normal. They don't have the protective capacity. Like this, you know the pathogenesis, you design the symptomatology yourself. Don't have to read books. Why hemorrhagic tendency? Platelets are normal, maybe slightly abnormal. There is no coagulopathy. Then why hemorrhagic tendency? Why? Everything because of the high proteins. If the platelets are covered by abnormal proteins, they will be easily destroyable. They will be easily engulfable by spleen, etc. So there is a secondary thrombocytopenia. Clotting factors will also won't work normally. So in spite of everything being normal, they will act as abnormal. Hyperviscosity. Do you have any idea? Hyperviscosity. When the plasma is very, very thick, full of proteins, it's called hyperviscosity. What happens in hyperviscosity? It affects small vessels of the brain, small vessels of the eye, etc. There will be sluggish circulation. So, eye problem, headache, etc., etc. The small vessels will be full of proteins which are in the plasma. So, definitely there will be some problems. Moving on to next. This is one figure. This is amyloidosis. Why I have talking about amyloidosis? Anyone? Amyloid have got different categories. AL. So, one type of amyloidosis is born out of abnormal proteins. So, multiple myeloma, amyloidosis, though looks like different, It has got relation. Only one type of amyloid. That's why I have given this photograph. Laboratory parameters are very important for you. RBC will not be affected. Always say normochromic, normocytic. WBC will not be affected. Achha, this is write down in the Viva. When we ask about, tell me the cause of increased ESR. Write down the question. Tell me the cause of increased ESR. What will you say? What will you answer? Anybody? Before that, tell tuberculosis. Tuberculosis is most rampant disease in India and in many Asian countries. So when you'll be asked about causes of high ESR, tell two causes, tuberculosis, plasma cell myeloma. Examiner will give you 100% marks. If you say another, you can say acute myocardial infarction. So there are three diseases. Cause of high ESR, tuberculosis, number 2 plasma cell myeloma, number 3 acute myocardial infarction. So why ESR increases? RBC is coated with antibodies. They adhere to each other. So there is increased rouleau formation, increased aggregation and precipitation. That's why simple. If you know the pathogenesis, you can explain anything in the world. Don't mark up everything. Oh. So you know what happens to platelet. By now you can design yourself. What happens to platelet? ESR is high. Otherwise, this is a normal picture. Serum creatinine is high. I have told you hypercalcemia, alkaline phosphatase. It's a accessory investigation, etc., etc. Beta 2 macroglobulin, often found in your MCQ question. Causes of rise of beta 2 microglobulin. It's a headache in higher examination, MCQ examination. So here is one of the cause, the plasma cell myeloma, where beta 2 microglobulin level are increased. Why we do this? কেন আমরা করব just to spend money? No. Beta 2 microglobulin will give a rough idea about prognosis. We are very much serious about prognosis. আমি যখন কোনো ইনভেস্টিগেশন করব, I'll order investigation, any test to our poor patient of India. I'll think of two things. First is for diagnostic purpose. আমি diagnosis purposes জন্যই I will do X-ray, MRI, CT. Second is for prognostic purpose. তার বাইরে I won't write any investigation. So this is about prognosis. Got my point? So I have discussed it already. We will do bone marrow just to see that this plasma cell increase is not due to other causes, other chronic infection. Just to see that, okay, this abnormal plasma cell, they are being originated from the bone marrow only, not due to other causes, etc., etc., other non-specific causes. So, just to prove. This is almost just end of the class. Just focus your attention on these cells. Can you identify from my class? Can you identify why this is abnormal? Cells are very, very big. Cells are eccentric. Cells have got nucleolus. Cells are binucleated. So, if I see, so don't read your book. Remember this picture. If you see this picture, if you can extract it from your brain, you can jolly well diagnose the case of plasma cell myeloma. Got my point? See. See how beautiful they are. Huh? How beautiful, almost an artist's imagination. Huh? You can just draw. Those who can paint, draw. These are for postgraduate. I'm not bothering you. Only just Russell body, Dutcher body. Just remember this name for your future MCQ examination. Remember these two names, Russell body and Dutchess body. Right at the corner of your notebook, these two names. Not important for your undergraduate examination. Can you remember? Can you make out? So forget everything. Remember this picture. You must have the practice of seeing X-ray examination when you are doing rounds in the wards, medicine ward, pediatrics ward, etc. Always, if there is any photograph, lift it up and see. See whether you can, because as a medical student also you are supposed to give a report on X-ray. X-ray is for everyone, not only for radiologists, everyone. So, osteolytic lesions in the bone. So, your elderly relative, which is more than 50 years, suffering from low back pain, came to you. You advised him to do a X-ray of the skull. If you see this, so you being a student of third year, you can diagnose which very good institution, medical institution cannot. This is so important. Forget everything. Remember this. Same thing. If you do a X-ray of the vertebra, maybe slightly difficult to interpret. Benz-Jones protein. Write the name on your notebook. This is asked in the Viva examination of the practical in final MBBS. Benz-Jones protein, one of the examiner's top favorite. High TRP. Write this name, record this on your notebook. Benz-Jones protein. For your future MCQ, write down CD38, CD138. Just write down these two. You will pass MD examination. CD38, CD138. Write down or underline your book. Not everything is important for undergraduate. This is important for under and postgraduate. I'm skipping this. This for postgraduate treatment. Age-old treatment is melphalan. Age-old treatment. Now it's a different regime. That will be covered in pharmacology department. Now this is VAD regime, VAD. In our time, melphalan, now it is VAD. So this is all. So what we discussed, a neoplastic lesion, a malignant lesion, which is from plasma cell, which is derived from B lymphocyte. Why it is bad? It is bad because it produces bad proteins, not normal protein. Why it has gone wrong? একটা ভালো ছেলে কি করে খারাপ হয়ে গেল? Why a good boy becomes urchin or a hooligan? Because of cytokines, different types of cytokines. If you remember IL-1, IL-6. I don't discuss everything in the class. Something is left to you to read and inculcate. So, the good boy becomes bad boy because of IL-1, IL-6 interference. Okay? So, bad boy is unable to protect the body. Bad boy, those proteins or paraproteins, they spread all over the body. They do damage to kidney, to hemopoietic system, etc., etc. So there is the X-rays are bad. The protein electrophoresis will get M protein. So there are different types of protein. How will you diagnose? তাহলে আমাদের কি হলো, কি I have to do? First a blood examination. Then main is serum biochemical markers. I'll do hemoglobin, I'll do calcium, I'll do creatinine for kidney, I'll do a simple X-ray. If suspicious, আমি আরো এগিয়ে যাব. I'll do one bone marrow, one serum protein electrophoresis. So if I get more than 10% plasma cell, if I get more than 3 gram% of protein, if I get different symptoms, different kinds of symptoms, I'll stamp it as plasma cell leukemia. Previously, I discussed about some leukemia which are very good, but take me that this is a very bad disease. So pray that no one should suffer from this disease.